Hi, everyone. My name is Shakita Micek, and I am the CEO and president of MB Formula. We have a joint supplement called Joint Hydration. And so this is Tim Micek, and I'll let him introduce himself.
Yep, Tim Micek. I'm an orthopedic surgeon for about the last 20 years. Trained at Syracuse and University of Virginia. Have had the product MD Formula that I developed about 10 years ago.
Nice. And I am Zach Moore, former 6-year NFL veteran, now turned certified personal online trainer and nutritionist.
Wow, Zach. So how in the world did you come from the NFL to wanting to do your own personal fitness business?
That's just the athlete in me. So I've been playing sports ever since I was 15, my freshman year of high school. And upon my retirement in 2020 from the NFL, it was always a big emphasis for me to keep my athleticism. That's something that I want to keep as long as possible. What tends to happen when guys retire is they get overweight, out of shape, health complications, and I want to do my best to avoid that. So I got into fitness. I want to say, learning about hypertrophy training, which is different from athletic training. I learned about that 2017 when I was with the Carolina Panthers. And ever since I did my first bodybuilding style workout, I liked it. I liked the stimulus. I liked the health benefits from it. So fast forward to, I want to say 2022, I went back to school and got certified through ISSA to be a trainer and nutritionist.
Wow, that's awesome. So with MB Formula, I became CEO and president because I just had the motivation to make sure that people were healthy, their joints were healthy, and Tim had formulated the joint supplement, and I just thought that it would be great to join the team. So give us some information on why you
went back to school. You want to tell us about that?
Oh, yeah. I did go back to school to get my master's in business. I'll be done May of 2024. So I'm excited about that.
Nice. Congratulations.
Yeah.
Thank you.
My turn?
Yeah, your turn.
I think just with the product, what I saw was that, Zach, as you know, people have joint pain, whether it's from athletics, whether it's from workers' comp, falling down. And a lot of people that come to my office don't want surgery. All right. And a lot of them don't want prescription medicine. There's a lot that can, from a complication standpoint, that can happen. So I basically developed this joint formula to help people move better, to help prolong possibly the onset of arthritis. It does not prevent arthritis, but it may prolong the onset of that when you've had injuries. And I've even used it in my practice and really on the East Coast here, mostly in Atlanta, through my practice to help people move better. And it's something that's been very successful. Obviously, with your background, and people watch the NFL all the time. I mean, not just the games, but the practices, how you're sore. I've been on the sideline for University of Virginia football. They hit hard, but you guys hit so much harder. And do you want to go into just what it's like to recover in a week from a game?
Yeah.
What is it like for the body?
Yeah, it can get tricky. So, how it's really structured in the NFL, Monday is kind of I'll go by Sunday because that's game day. So Sunday is game day, we're beat up from that. Monday is kind of we come in, do a flush lift, flush run, and then we do film review. Tuesday is our day off. Well, some teams, they'll have their switch. Their day off will be Monday, then you come in Tuesday. Then we're back on schedule, hitting in pads Wednesday, Thursday practice. Friday is a short, we call it Fast Fridays in the league, so there's no meetings after, so it's a shorter practice. Then Saturday is walkthrough, and then Sunday it repeats itself. And then you have some instances where teams will play a game on Sunday and have to turn right back around and play on Thursday. So there's a short window to recover from that. Now, I've been in that situation before, so playing in the league or playing a violent sport like football, it does have wear and tear on the joints, especially in my position. I played on the defensive line, so we're constantly hitting offensive line and taking on pulling blockers and getting crackback blocks. It's just constant.
How did you take care of your body?
A lot of mobility stretching after practice, a lot of flush. I want to say the flush runs helped after games on Mondays, and also massages, weekly massages helped keep my muscles elastic. And then the biggest part is nutrition. I think food, food is diet medicine.
Absolutely.
So
Absolutely. Did you use any type of supplements while you were in the league?
No, not for like joint pain. Like, see, the thing is, until I left the league or I retired and I got into the fitness world and I started like studying this stuff,
Right.
I didn't really take supplements in the league. It was kind of like I just did what was provided in our training tables or whatever the case may be. So I had no knowledge of really nutrition in that fact. I just ate whatever they had there. But I don't remember taking any specific supplements, and not for like health things, maybe like a pre-workout or something
Sure.
for
Of course. Yeah.
yeah.
Right. Well, that may be a good segue just to talk about why we're on this call right now, why we're doing this. I mean, our product, and you want to show the bottle? So MD formula, it's something that I developed. I'm just going to give a very, very brief review of it. And then maybe you can tell us afterwards just how it's helped you. All right. So MD formula, it's a safe product, meaning there's no prescription medicine in it. It has really three main ingredients. And if anybody who's watching this wants to look these up, these are very well studied. Glucosamine, chondroitin sulfate, and the thing that makes ours a little bit different is hyaluronic acid. All three of this has been shown to support joint health. What's that mean? Well, when you have a joint, say a knee, there's a space in between where it bends. In that space is cartilage. That's kind of the soft, spongy stuff that gives us padding. Now, in the knee, there's cartilage on the end of the bones called articulate cartilage. And then we call it meniscus. It's a cartilage that helps cushion the knee as well. So this product has been developed to help people move better, help to support that cartilage, and really help the body to possibly even repair itself. Now, I didn't say we're helping repair it with our product, but you can repair some cartilage. So that's kind of what's in the product. And you've been at it for a little bit here. Could you tell us like kind of how you've been sensing? Has this helped at all? Are you?
Oh, absolutely. I think we had this talk before. Like, so in the mornings, that's when my pain is at, sometimes intolerable levels. I do have permanent neck and lumbar spine damage from football. Also, poor movement in my knees and ankles, and that just comes from playing a position of defensive line. So joint pain is something that I deal with on a daily basis, and that's something that I've been looking to improve. And it's actually great that Shakita reached out and she, recommended the supplements. I've been taking it for a month, and it decreased my pain in the morning, especially because that's when I mostly take it. And what I want to say is that I'm glad that this has been a part of my morning routine, because if I can eliminate my pain as much as possible, well, I shouldn't say eliminate, decrease my pain as much as possible in the morning, my whole day goes smoother. So, in taking this, I'm waking up in less pain. It's been gradually, but progress is still progress.
Right. Well, that's another thing too. If you look at the studies, typically any product that is a joint support product takes about 3 months to see a noticeable benefit. Now, in the last 10 years, I've had multiple, hundreds and hundreds, possibly thousands of testimonies that people say it works quicker. Now, that's not something where I say, hey, buy a month of the product and you're going to see a benefit. Now, I'm glad you're seeing a benefit, but usually it takes about 3 months, whether it's our product or anybody else's product, to see some benefit, because the supplement is not a drug. All right, there's a big difference there, but it's something that hopefully can support. But the point is, for the people who listen to this, it's about 3 months to see a benefit.
Yeah, I'm very much looking forward to hitting that 3 month and beyond that, because this is something that, I continuously want to take to, drastically improve my joint health, because especially my knees and my right ankle, my left wrist, like I've had some, some blockage in there, and it sometimes get difficult to squat and just do daily, functional movement. So yeah, I'm looking forward to, being on it long term.
Very nice. I don't know if maybe it just very briefly too, we can say what maybe separates our product from other products. People are listening. There's a lot of joint products out there, and we're not trying to put down any product whatsoever. The reason that these are important to me, that as a medical provider, people come to me and they trust what I'm going to tell them. Look if you've gone to an orthopedic surgeon and they say you need surgery, you better trust that guy, that he knows what he's doing. He has the best interests for you. So that's the passion that's come with this product, is that this product doesn't have anything that is what's in the bottle is on the label. There's no additives. There's no fillers. This is a pure product. If you go on our website, mdformula.com, you can see studies we've done through independent labs that says If it says it has that in the bottle, it's there. And it's actually, it's 100%. It's like 103%. Is that was of purity in the bottle. So that's very important to me, that if you say that this is going to help you, I want to make sure that what's in the bottle is in the bottle. And that's a part of trust that we have in the medical community. I mean, even your teammates, you know, if you're doing a stunt and you got to believe that guy's going to be there, there's got to be a trust, you know, not only in athletics, but in the medical community. You know, my brother's in contracting. Boy, if he says he's going to build this house, there's trust that he's doing it the right way. And that's that we've talked about a lot, is that we want people to know that this is I'm not calling it a family business, but this is something that's not from a big company where there's huge corporate executives that are trying to push a product on somebody. This is something that it's personal to us, and we truly want to help people move better.
Yeah, that's a big thing for me. I always believe in movement is medicine. So the more I can move, the better I can move, you know, the better my overall quality of life will be.
All right. Love it.
Yeah. Well, thank you so much, Zach, for meeting with us today. We really appreciate it. If you all would like to get MD Formula, you can go to www.mdformula.com. We're also found on Amazon.com, and you can find it on TikTok as well. So if someone wanted to get into your personal fitness training, like, where could they reach you?
I have a website of Zach Moore, ZachMoore.upscaletrainer.com. And there I provide, you know, personalized nutrition plans, personalized fitness plans, accountability, kind of in the realm of what Doc is doing, of supplements that I take to help increase testosterone health, habit coaching. You know, I kind of lay it all, and I got, you know, plenty of testimonials of transformation to back these up. And that's really why I want to emphasize to everybody that's watching this, you know, take better care of your health. As Doc has explained, you know, as we get older, movement becomes difficult, whether you play sports or you live a sedentary life. You know, if you're not actively strengthening your body, you can go through osteoporosis, which is weakening of the bones. And that's something that we all want to avoid. So I want everybody that's watching this to be more proactive about their health.
Right. Now, you said, when we kind of talked about before, this is mostly based to the male population. I mean, how do you
so my niche is hypertrophy training, and I do cater to men, try to help men, you know, increase their physical health, mental health, which is also in correlation to their testosterone health, because that's how I really got into building my own online platforms, because I was super overweight in 2021, which, you know, affected my mental health. I checked into a mental health rehabilitation center in California in April. It was a 30-day intensive. First time I ever got therapy. And that whole year, you know, I just kept spiraling out of control, to whereas, you know, I gained so much weight. I was the heaviest I've ever been in my life. And I remember how it affected my physical health, mental health, testosterone health. So once I went on a 4-month transformation plan, not seeing the many great benefits of what I was doing, I knew that it can help other men as well.
Yeah, that is really good.
That's a great testimony.
Well, we'll send you away if we can.
Oh, yeah. The fact that you're
appreciate it. Yeah, you know, I provide a safe space for men. I'm actually building a Facebook men's support group because I want men to, you know, be more proactive, because, you know, we're the pillars of the community. We're the leaders. You know, we're the head of households. We have to be there for our families, especially for men who have kids, who want to be around them, see them grow up, play with them. If they have kids, be around our grandkids, play with our grandkids. So as much as I can help men naturally increase their testosterone, their health, then that's, you know, that's been my mission ever since I retired, to try to give back, pay it forward.
Right. Love it. Well, we're kind of in the same point of view. I mean, you know, people coming in, you know, shoulders, wrists, hips, you know, ACL tear, all this stuff it's to get them fixed and get them back where they can start providing for their families. They can have, and look, if you're hurting, as you know, your mental health goes down. I mean, I'm not.
So you want to know what's interesting? My therapist told me that was, and I didn't even know this term existed, but it's called somaticism, when your physical pain manifests itself in the brain, and that, you know, that can deteriorate your mental health, which is something that I was going through but didn't know at the time until he introduced that word to me. I thought that was pretty interesting.
Right. Well, we appreciate it. I'm glad you're seeing some benefit with the product. Stick with it for the next couple months, and hopefully after that, if you think it can help others, pass it along. But we appreciate your time, your story. it's been good for me just to get to know you and, know what it's like kind of behind the curtain a little bit from the NFL, but also, you guys are not just big, fast, strong, and smart. You're real people and you got real issues. And, it's good to see that. And I think other people need to see that too. Same from surgeons. We have same, issues that other people. It's just things that we're somehow held to a higher standard. And I don't mind that pressure, but it's good to see that, you're doing something good, not only for yourself, but for others. And just thanks for taking the time. Really appreciate it.
No, I appreciate y'all for introducing this product to me. It's, like I said, it's been phenomenal so far, and I can't wait to see how well it works long term. So thank you guys again.
No problem. We're actually working on a code on our website where we'll put like Zach, where if anyone is interested, they can get 10% off of the product.
Okay, perfect. Also, do you guys have an Instagram? I do post products that I use on Instagram. Social media is like a big tool for me to do promotion. So if you guys have a Instagram well, I know you got the website, so I'll link that too.
Yes, our Instagram is at @themdformula_, and our TikTok is @mdformula.
Okay, perfect. MD Formula. Okay, hold on. That's not the right one. It's MD Formula.
There we go. There's a promotional.
Yeah, I get it.
All right. All righty.
All right. Thank you for taking the time out, Zach. We really appreciate you.
No problem. Appreciate y'all. Y'all have a great day. And if y'all need anything from me, just let me know.
All right. All right. We'll see you.
Bye.
Yep, thank you.